Welcome to the Defeating Epilepsy Foundation YouTube channel. At the Defeating Epilepsy Foundation, our mission is to provide the advocacy and educational resources needed to the epilepsy community and our society. We are dedicated to removing the stigma associated with epilepsy and help to create opportunities for individuals battling epilepsy. In this discussion, we will talk about what sexual health is, the importance of practicing safe sex, how socioeconomic factors play a role, the risk of pregnancy complications, resources available to practice safe sex, and our conclusion. According to the World Health Organization, sexual health is defined as, quote, a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination, and violence. For sexual health to be attained and maintained, the sexual rights of all persons must be respected, protected, and fulfilled, end quote. Epilepsy can cause complications when it comes to sexual health. For men, anti-epileptic medications can reduce testosterone levels. Individuals with temporal lobe epilepsy are at greater risk for developing sexual dysfunction. Women can experience lack of desire, lack of arousal, lack of orgasms, and sexual pain caused by the side effects of anti-epileptic medication. It is important to practice safe sex. One reason is to prevent any unplanned pregnancy, especially if you are a woman battling epilepsy. The second is to avoid contracting an STI or an STD. Both terms sound similar, but they are two very different things. An STI, or sexually transmitted infection, is an infection that has not yet developed into a disease. HIV, or human immunodeficiency virus, is an example of an STI. An STD, or sexually transmitted disease, is a disease that results from an STI. Acquired immune deficiency syndrome, or AIDS, is an STD that develops from HIV. It is challenging enough battling epilepsy, which is why people with epilepsy need to take precautions and protect themselves. Many individuals battling epilepsy face economic challenges. Many cannot gain access to contraception due to the cost. People who fall into the demographics where they are more economically challenged are more likely to have unplanned pregnancies. According to the U.S. Department of Health and Human Services, the poverty level for one person is $12,760. The estimated monthly benefit for SSDI is $1,259, or a little more than $15,000 per year. Being so close to the poverty line limits people to gain access to affordable contraception. Women with epilepsy are at a higher risk for developing preeclampsia, gestational hypertension, and bleeding complications during and after their pregnancy. The Pregnancy and Lactation Labeling Rule, known as PLLR, helps to assist healthcare providers about the risks versus the benefits. When I was expecting, they assigned a class to the medication. In some situations, it is better for the patient to stay on a certain medication rather than change to a new one. If you are expecting or trying to conceive, consult with your doctor before making any changes to your medication. It is important to gain access to contraceptives to prevent unplanned pregnancy and protect oneself from STDs. For those who cannot afford birth control or other forms of contraceptives, there are nonprofit organizations that will assist those who need help. Power to Decide is a nonprofit that focuses on preventing unplanned pregnancies, educates about sexual health, and helps to find contraceptives at a low cost or for free. Planned Parenthood provides educational information about different types of contraceptives, how they are used, their cost, and how to provide them for free or at a low cost. It is important for individuals with epilepsy to understand sexual health. It is important to practice safe sex when battling epilepsy to prevent unplanned pregnancy, STIs, and STDs. Socioeconomic factors can play a role when it comes to someone being able to gain access to contraception. It is important to understand the risk anticonvulsives can have on a fetus. There are community and nonprofit organizations that will assist those who need help to obtain affordable contraception. To learn more about sexual health, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos on our channel and subscribe today. You have the power to defeat epilepsy.